Thank you and good afternoon, everyone. Thank you for joining us. And hello to all of our community partners. My name is Noah Gallo, and I'm the Mental Health Services Act Senior Planner with Alameda County Behavioral Health Care. I'm coming to you today from our Mental Health Services Division, and I would like to welcome you to this afternoon's Mental Health Services Act 101 webinar on how to read the MHSA plan. This webinar is co-hosted in partnership with our MHSA media partner, HHREC, or the Health and Human Resource Education Center. All right, slide 2. Let's begin. This webinar is part of our outreach efforts to publicize the release of the Mental Health Services Act Plan update for fiscal year 24-25. This MHSA plan or report really celebrates the accomplishments of all of our community partners and the programs that we help coordinate and support here in Alameda County. And we'd like to use this webinar to uncover or provide a high level overview of the MHSA plan and its purpose, functions, and uses to make it more straightforward for you, the public, and to be able to read it to increase your knowledge of relevant mental health services. For questions related to specific programs, projects, and details, we definitely encourage you to visit our website, which we will highlight at the conclusion of today's presentation. We'll also put our website in the description of this video. So once again, the purpose of this webinar is to increase community awareness and understanding around MHSA and to further the public's knowledge and provide you direction on where to provide public comment, period. We have some highlights that we'll be reviewing today, and we'll definitely go over MHSA and its regulations, what the plan approval process is like, and we'll review the location of this plan so you can know where to go to access information. We'll provide a funding overview and some program information that's located in the plan and also where you can provide feedback of the plan. So our educational goals today are that you hopefully will be able to define what the Mental Health Services Act is. You'll be able to find where this plan is, and you'll know where to find client stories and experiences located in this plan. I will show you where to find resources for vulnerable populations, and lastly, that you'll be informed of opportunities to provide community input as we develop the plan. And so our structure of this presentation is identified on the slide. We'll start with an overview. We'll go over plan sections and content. And assisting me with this will be HHREC's MHSA Program Manager, Robert Williams. One last takeaway is that we hope you're able to learn about services that are available to you. And you can visit our website, which we'll put in the description. All right, slide 3. All right, so we thought it would be helpful to include at the beginning of the webinar a glossary of terms. Many of these terms will be used throughout today's webinar and will be outlined at later points. But we do want to feature that this slide will be available on the recorded webinar presentation. So you can go visit our website or ACMHSA website or HHREC's website later on to view this recording. But we do want to note a few terms that will be used throughout this presentation. The second bullet point you see on the screen here is CBO, and this references our partners in the community that manage MHSA services. So this is a community-based organizations or community-based agencies, and you can use those terms interchangeably. Another term we use often is CJI, and that means individuals with some level of criminal justice involvement. Then, of course, the really important term is MHSA, which is about the eighth bullet point down, and we are referencing MHSA. We're talking about the Mental Health Services Act, which is the subject of today's presentation. Okay, next slide. So before we get into the presentation more, what I would like to do is provide you some background or context as to what the Mental Health Services Act is, or MHSA. MHSA is very unique to our beautiful state of California. California voters proposed Proposition 63, also known as the Mental Health Services Act, or MHSA, at the November of 2004 general election. And the MHSA was about promising to greatly improve how mental health services are delivered here in California and how individuals receive treatment across the state of California. MHSA is able to be funded by taxing very high income individuals at an additional 1% portion of their annual income that exceeds $1 million. So, MHSA really represents this inclusive approach to develop community based mental health services and supports for California residents in Alameda County or locally. The Alameda County Behavioral Health Care Services Department, or ACBH, administers MHSA, and to provide an organized implementation of MHSA, we receive oversight from the California Department of Mental Health. Slide 5. So the MHSA is very broad and rich, and you can think of it as being broken up into 5 different buckets or 5 different compartments. And each of these contains programs and projects that are highlighted in the MHSA plan. And I will discuss each of these 5 components or areas later on, but I do want to at least address them. The first component you see on the screen here is the community services and supports, and this makes up about 76% of our funding. The second is prevention and early intervention, also labeled PEI. That makes up about 19% of our funding. The third component is innovation. It makes up about 5%. And the fourth is workforce education and training. And the last is our capital, facilities, and technological needs, or CFTN. And so all of these, our component areas and their programs are monitored locally by Alameda County Behavioral Health Care Services, Mental Health Services Act Division. The, the MHSA division is responsible for coordinating all of the planning activities and maintaining oversight of how money is distributed to fund these programs. MHSA in Alameda County not only funds MHSA county staff, but locally we provide funding to over hundreds of county civil service positions, which is about a quarter of our department's workforce. And we also provide funding to support hundreds of community based organization positions and thousands of individuals in our county who receive some sort of treatment or service through MHSA. Next slide. So this slide is the MHSA goals and values. Our vision is to transform the mental health system and improve the quality of life for people living with mental illness and for those who are at risk of mental illness and mental health challenges. All of our funded activities are guided by these 5 goals you see on the screen. And these goals guide us to transform the mental health system by improving the quality of life for consumers. We define the term consumers as people who utilize or consume mental health services. We strive to continue providing effective prevention and early intervention services. We provide outreach support services, and we ensure that there's family involvement and family inclusion, and of course, increasing access and reducing inequities for underserved populations and inappropriately served populations of the county. The MHSA's purpose is to accomplish these goals through all of these projects and amazing activities by embodying these core values of community collaboration. We want to be culturally responsive, and we want to be consumer and family driven, and we want to constantly be promoting wellness, recovery, and resiliency. Okay, next slide. Yeah, so you can see on the screen the different clients we serve, and what I want to do is just really emphasize that there's an integrative service experience across the board. To use MHSA services, there are specific eligibility criteria which are outlined on the screen. MHSA was written to address the specific needs of populations that you see here. Individuals with serious mental illness or SMI, as well as individuals with severe emotional disorders, individuals who are not being served or being underserved by our current mental health system. Our services must be voluntary our services must be in a voluntary setting. So generally, MHSA dollars cannot be used for involuntary services, such as persons who are incarcerated in state prison or any other locked facility. However, there was specific legislation that was passed in our state that amended this to allow MHSA funds when nothing is available to be used to provide mental health services to people who are participating in pre-sentencing or post-sentencing diversion program. People who are on parole, probation, and post-release community supervision, also known as PRCS or mandatory supervision. And of course, there may be some select exceptions to this. Okay, next slide. So what is the plan? We've covered the basic foundation of the plan, but now let's get into some more of the state regulations. Okay, next slide. So the MHSA plan is highly regulated by the state and codified in California's Welfare and Institutions Code. And like I mentioned before, our county mental health program is facilitated by the Alameda County Behavioral Health in the state of California, which require counties to prepare and submit a 3-year MHSA program and expenditure plan. The expenditure plan details how we will use dollars for services. The 3-year plan aligns with our 3-year funding cycle based off of the state's tax seasons. And we're also required to update this 3-year plan on an annual basis. And this is known as the annual update. And that's what we're doing today. We're presenting the annual update for FY24-25. For the annual update, part of the process requires us to collaborate with constituents, which means voters in Alameda County and stakeholders. Stakeholders are defined as individuals who have a vested interest in mental health services, and these plans have to be approved by our elected Board of Supervisors before they are submitted to the state of California to be reviewed and approved. Next slide. All right, so this is our comprehensive process that's involved with developing this annual update and 3-year plan. But today I'm going to talk about the annual update. So this process identified in the slide, the first box is what MHSA is required to develop and prepare for a uh, 3-year plan as well as an annual update, and that there's further requirements around what is located in the plan and what we have to put in the plan. And so far, as of now, we're in the second year of our 3-year plan. And so this annual update covers what we're doing and what we propose to do for the next fiscal year. And for the fiscal year, we go off of the state's fiscal year, which means that we plan on doing July 1st of this year through June 30th of the next year, which you can see here in boxes 2 and 3, and basically describes how the plan has to be approved locally. There has to be a 30 to 45-day public comment period. We've opted to do a 45-day public comment period, as was requested by our mental health advisory board. And so the public can view the plan, it can provide comments during this time, and respond to and the mental health service team will have to respond to the public's comment. And at the end, we'll have a public hearing with our local mental health advisory board before before the annual update makes its way up the chain to the board of supervisors. And this can be seen here in the last box. So if you look again at the second box, we are in the process right now of having drafted the annual update plan. The plan is currently available to the public, and we have until the middle of May, May 15th, or 45 days for the public to review the plan before the final editing process begins. And this process can take anywhere from 6 months to a year to complete. Next slide. So yeah, so where is the plan located? Where can you access the plan? Next slide. So yeah, so this is our website. This is where you can find the plan, and our plan is located in two specific places. Two places locally. The primary place being public postings on our Alameda County Mental Health Services website. This is our Alameda County Mental Health Services website. That's acmhsa.org. And so when you click onto this website, you'll be received by a pop-up blocker that allows you to provide public comment to this plan. But after public comment has ended in May 15th, you'll have to click where the arrow is at under MHSA info and scroll down to plans. The second website that our plan is hosted is on our Alameda County Behavioral Health Services website, or ACBH. You can go to the Plan Administration, then to Mental Health Services Act, and here you'll be able to find the Document Center. And we highly encourage you to go there so you can see what's going on locally that Alameda County is doing to provide mental health services. So now that you've learned about MHSA and the five different components, the five different buckets, and the specific regulations that go into this plan and where to find this plan, we're going to dive into the plan and talk more about it and how to use the plan. Slide 13. Oh, excuse me, next slide. Yeah, so here on the screen, you can see that the plan is grouped in three different sections. And each of these sections contains different chapters. Um, And I'll start with section one. Section one provides a background and the overview defining the Mental Health Services Act, our current themes for the year, basic data around the county, and stakeholder community input uh, that we use to inform services. Section two contains the actual meat of the plan and why it's so dense and robust. There are program summaries, and these are divided up by each of MHSA component areas. This is the majority of the plan since it discusses most of the funded programs. Section 3. This is the appendices. This is where we put supporting information, anecdotal information that might be too large to fit in the report, but this is where you can go to find this information. It's still very important, and I encourage you to check it out. Next slide. So yeah, on the screen you'll see a preview of the table of contents. Here are some tips uh, for uh, for examining uh, the table of contents. It's our cornerstone of the plan. You can think of this as your resource guide. Every single MHSA funded program is contained in this document, and the program names are pretty descriptive. We've also color coded the different buckets this year, so you'll be able to know where each bucket is, whether it's community service and supports, uh, our prevention and early intervention, or innovation, our CFTN, or our wet section. And so one thing you'll notice that we did different this year was we put these color-coded tabs on the side of the table of contents. And this is so that the reader can can go to different parts of the report without having to scroll back to the table of contents. So if you want to skip to a different section, it's right there at your fingertips. Each of these tabs is hyperlinked, and they follow you on every page of the report. And we're pretty excited about this because that was some of the feedback we received was the length of the report, and we circumvented this by adding different hyperlinks, tabs, so you can click around the report uh, and make sure it's easy to use. Next slide. Yeah, so another part of section one. So yeah, section one includes the executive summary. And this is a great area for people who are short on time. This chapter is the executive summary, and it's a letter directly from our department director. And that director's letter is like an introduction, and it endorses the plan and current practices and all the data is very highly descriptive, and it synthesizes a multi-hundred page report into bullet points in less than 5 pages. So it'll define what MHSA is, and it'll give you a really quick paragraph on our working budget for next year. The executive summary also highlights community trends, feedback from the community, our community input, and summarizes how we included community designing the program process and initiatives. And we do this all under 5 pages. So if you don't have time to read the report, I highly recommend that you read our executive summary. Next slide. So the next part of section one is the plan update and summary of changes. And this is a great area for people who are just looking for what changed from last year to this year's plan. What updates did the county made? So this is a great place for you to start. It really identifies the department's current priorities that we summarize in the executive summary. In this part of the plan, you'll see how the community input from previous years impacted current and planned activities. We identify programs and initiatives by getting feedback from you, the public, through surveys and interviews, and an extensive planning process, and through public comments. And information is gathered from our community stakeholders. Needs are also expressed directly to county leadership from impending legislation that's going to impact us locally through local trend reports, external events such as a surge in population, such as unaccompanied immigrant youth, if there's issues in the justice involved population, or if there's a surge in a refugee or migrant crisis. So here you'll go to see some of our efforts to expand our service teams and provide more funding to different PEI programs that serve marginalized populations. So you can find out what's different from last year to this year in the plan and update summary of changes. Next slide. All right. So this is another important part. This is our funding overview. This is the budget. We have comprehensive funding overview that's provided in our plan. This is a report, revenue and expenditure report, and is very specific, standardized in a way that allows us to report our financial status and how we allocate funds to different programs. On this slide, you can see a flow chart, and it helps describe how money comes from the state and makes its way back into the county, into the local community. So if you ever were wondering how MHSA gets our dollars, it comes from income taxes in California, that 1% tax on millionaires. And then that money goes to the state's treasury office, and then the state's treasury office allocates or provides money locally to our counties, to our mental health plan, and that money is managed by our local auditor controller's office. And then that money is placed in an investment account so that we can reap some sort of benefits. And then we distribute that money back to the community. Uh, I know that's a long process, but it's explained here in on the slide. And so we're projecting about 189 million dollar budget that is going to be going to our local services. And so yeah, so we're required to enter into contract or agreements with local community-based organizations. And these CBOs are experts in a particular area and will actually use those dollars to provide services directly to you, directly to the community. So this entire process is heavily regulated, it's heavily scrutinized, and there's a lot of eyeballs making sure that there's accountability and our dollars are being spent correctly and making sure that they go to the client, to the consumer. Next slide. All right. So yeah, so another place you can find the funding summary is a chart, and on this slide you'll see a spreadsheet. And I'm going to spend a little bit of time breaking this down. We receive so many questions around budgets, and I know it can be a little confusing to see all these numbers and all this information. So yeah, so this will be located at the beginning of the plan, and this is a budget overview of how much money we can spend for each of those five component areas that we shared in the beginning. And so let's break this down line by line, starting with the very first category you see, which is estimated money for this coming fiscal year's line one. So estimated unspent funds from prior fiscal years. So MHSA funding is reported over a 3-year cycle. We're several years behind based off the tax season. So we have up to 3 years to spend down. And this is what we're telling you how much money will be in our budget and how much money is unspent. And then number two says estimated funding. So this is going to be new money that's given or allocated to us by the state based off our current income taxes. Line three says transfer. Well, what does this mean? Well, based off of MHSA regulations, we can transfer money from our CSS component to another bucket. And so this money could be taken out of CSS to fund some of our WED initiatives, our workforce uh, initiatives, and some of our capital improvement area. So under line number four, that acts as local prudent reserve. That's the prudent reserve is basically a mandatory savings account for rainy day funds. If there's an event that impacts us and impacts state money like COVID, then we at least have some money to set aside and use this in a rainy day account. And the state tells us how much money we are required to have here that we basically cannot touch these funds. And then so in line five, uh, you can see the estimated available funding, and we can summarize everything by the second line, which is estimated funding for the next fiscal year. And this is where we get this 189 million number, and it's the same number that you're going to see in our executive summary. So the $189 million is how much money we plan on expending or giving back to the mental health services locally in our county. And we get that money by basically adding up everything from column A to column E. This is how much money we think we're going to be able to provide to the mental health services in our community. So hopefully walking you through this funding summary will shed more light and it will help you review the funding budget in this plan. Next slide. Okay, so yeah, our Alameda County profile. Another section, this is another part of section one. It's our Alameda County profile, and it provides an overview of the county and our current mental health needs and our programs and how they're determined through data and local trends that we're seeing. In this section, we provide an overview of information that helps us determine how to prioritize services in such a very diverse county. In this chapter, you'll see some demographic information about Alameda County. In this section, you also learn more about the burden of poverty. So, you know how many people in our county are renting versus owning? how many people are on food assistance programs. There'll be some fiscal information, fiscal health indicators, like what's the environment like in Alameda County? How many people are disabled in our county? What are the crime levels like? And if there's any environmental health information, because you know our environmental health issues impact us locally. So there's also information about healthcare utilization rates and what our mental health needs, and then what services are in this population utilizing. So this is a great chapter if you're into data trends and you want to learn more about the county, or if you're a grant writer and you're researching how to do a school report. Slide 20, next slide. All right, so this is the very last chapter of section one, and this is where the public is able to provide input on mental health that they've identified as a pressing need. Next slide. Yeah, so our community input section. Our community input is received throughout the year, but there are two main times during the plan process where that occurs. The first is right now through the 45-day public comment period. And we were able to develop this plan through other processes, and that's when we conduct a community program planning process, or better known as the CPPP. The CPP occurs every 3 years, but us here in Alameda County, we actually like to do the CPPP on an annual basis. The community input process helps guide our department to prioritize needs, especially if there's any extra funding available. This process allows us to identify new programs and potentially fund them. And it also expands existing program with a positive feedback. So providing community input is really important to help guide our funding. And you can learn more about the CPPP in this chapter of the plan, and by navigating to the dependency section, where we literally include a full transcript of every single comment or piece of feedback that was provided through surveys or through community forums and community listening sessions. So, in terms of who can provide feedback, that's anyone through this CPP process. We prioritize specific populations because we want to make sure that it's reflective of the diversity of our county. In terms of the geographic location, people are coming from different ages, genders, race, ethnicity, and making sure that people who are actually dealing with the mental illness or their family members are invited to participate as well. And so data from this process greatly influences our planning process for future programs. And so that's the end of the CPP section. And this is one part of the plan that lays the foundation for everything else. And so, again, in section one, you're going to learn about the budget. There's an executive summary that summarizes the entire plan. And you're going to learn about where we get our data from and different trends from our data and the process we use to engage our community stakeholders. Next slide. So we're going to move on to section two of the MHSA plan, and this comprises the majority of the entire document. Next slide. So section two, in terms of tips, is this is where you can learn more about current and planned MHSA services provided through our extensive network of community-based partners programs. And so we identify under MHSA components uh, all programs. We require programs to have a summary report with a standard report layout, a template. So oftentimes we hear that no one is aware of MHSA as if it's a program, it's the whole program. But you're going to learn that there are many familiar agencies that you're aware of locally who receive MHSA dollars. And so you definitely want to use this section as part of the plan to review programs, use them as a resource guide to find one for you, a colleague, a friend, or a family member. And so you can get familiar as to what's provided locally. So this is the part of the program where we're going to have a description of all the plans, and this is where you can go and read up on different plans in your area or throughout the whole county if you want. Next slide. All right. So all of our program summaries, for the most part, have the same standardized report layout. And I want to take some time to review that format so you're familiar with how program summaries are laid out, and these reports are provided by our service providers. And the data displayed in each report is what the state requires us to demonstrate. This data is largely qualitative, which means it's a word-based data with some quantitative or quantity or numeric details. Page 1 of the MHSA component area will always tell you more about what it is. So if it's innovation or if it's CSS, there's always a large piece of data to give you an idea of what's happening in that component area, followed by a client story, a success, and after that, you'll find each of these programs or projects are funded by that component area. And these program summaries always start with an identifying number that aligns with where they're located on the budget. So each program has an identifying number, and that number you can use to find out different information about the program in our report, and those numbers are hyperlinked so you can click around easily. So the name of the organization that administers the program is assigned a number, um, and you'll be able to find out how they receive dollars, how much money they've received, and then the number of children or adults or seniors that that program is serving. And then other pieces of data in our reports, uh, you can learn more about that program. And just to give you an idea of the framework we use a framework called the Results Based Accountability Framework, or RBA. And this basically provides performance metrics. And we use three questions that you see on the slide uh, to guide what we do. So it's very simple. One of the questions we use is the three questions we use as part of the RBA framework are: how much did we do? How many people did we serve? How well did we serve the people? So this outcome data determines if anyone's better off, and we're looking for in terms of determining how well a program is operating. And so in the second section, the very first MHSA component that's covered is community service and supports, or CSS. So the CSS is the largest of all five components in terms of how much money they receive. CSS is about reducing disparities, homeless involvement with the justice system, and child welfare system, as well as hospitalization and frequency emergency medical care visits. So funding for CSS is directed towards providing services to adults and older adults with serious mental health and serious illness. Children use uh, children use our CSS programs as well, as well as serious emotional disturbances, and people who meet specific criteria in CSS. So CSS is broken into three different service categories, which have specific models. But overall, CSS has about more than 80 projects that are funded through more than 43 work plans, and this component almost receives over $100 million annually. And so this is a great area for you to go if you're looking for direct treatment services for adults or children with severe mental illness or severe mental emotional disturbances. All right. So the second component in section two is PEI, or prevention and early intervention. And PEI is all about understanding underserved communities before the onset of mental illness, prevention, or intervening very early on. And it does that, and PI does that by providing outreach to families and providers, having stigma and anti stigma campaigns to reduce barriers, and making sure that there's early linkages to early medical care. And so PEI is a great place for you to go if you're looking for services that intervene very, very early on. And because this is early intervention, it's no surprise that a huge portion of PEI programs serve children and the transitional age population. So you'll find school-based services here, campaigns for grief-related issues for youth, teenagers, college-age individuals, and a lot of underserved ethnic and language programs are located in our PEI, as well as programs for more marginalized cultural groups. Uh, yeah, and so we also have programs for the Afghani population, for the Latinx population, for the African American, the LGBTQI population. And so we are very inclusive. So this is a great place to go for that. So overall in PEI, we fund about over 40 projects and currently about 24 work plans. Next slide. So the third component of MHSA is our innovation. And this is where we have a lot of flexibility in terms of coming up with new ideas. Innovation is aiming to increase access to underserved groups. Programs have to increase the quality of services. And increasing access to services, and basically, these are time limited programs that are things that we've never done before in Alameda County, or maybe not have been done for a specific population. So, again, something that's innovative. So, you want to come here if you're looking for projects that could be funded. You want to see what's new in the mental health field. And if there's something unique that we're doing locally, this is a great place to go. Also, if you have an innovative idea, something that you think would solve or improve the mental health system, you can actually submit your ideas to innovation, and that's how these programs uh, get funded. And these are a very limited amount of programs that are funded, and so this picture on the screen is a picture of our one of our more successful innovation programs, and this is our community assessment treatment teams, also known as the CAP program. And so these are mobile crisis teams that partner with law enforcement when there's a serious issue in the community, and that we have the opportunity to create trust between our clients. Our services, and law enforcement. So these are a few ideas that you can think about here. And next slide. So our fourth MHSA component area is workforce education and training, or we like to call WET. Our WET program funds programs designed to enhance our mental health workforce to make sure that we are training more people that address the shortage of qualified people who provide mental health services. And we want to make sure that we are creating a workforce pipeline with people who are reflective of the diverse communities that we are serving. And so WIT has more than about five different funding strategies, costing around $3.5 million, a little bit more than that annually. And so part of this is transferred from our CSS account. And per state regulations, some of the wet things we do have to provide training and technical assistance. So there's a college pathways program, internships programs that provide financial incentives. And right now we have a loan repayment program for mental health providers. Since it's so expensive in our county, in Alameda County, and a lot of our providers have these licensures and might be coming into entry level positions. So you want to visit the wet area if you are looking for human resource projects, or what are we doing to address the need for more diverse workforce because without our workforce, you can't really provide the robust services that our clients want and our clients needs. Next slide. So the very last MHSA component area in this section 2 of the plan is capital, facilities, and technological needs, or CFTN. And CFTN finances capital and infrastructure projects to support how we implement our programs. We're allowed to use funding to improve or replace technological systems and to fund other like building projects. So CFTN is a great area if you're looking for new building projects or what we are doing to address some of the technological barriers that exist in terms of improving how care is provided to other individuals. Again, CFTN funding is transferred from our CSS bucket, and we have more than 6 different ongoing projects that receive a chunk of funding from this area. Next slide. So the very last part of section 2 of the plan uh, is a huge section. This is our well, it's not huge in terms of length, but it's something we're very proud of that we do improve year after year. And this section is called Performance Management Initiatives, or PMI. So this is where we have accountability, which is really important to us. And this section summarizes our data-driven actions, our performance man, our performance management actions. And so this is a process to ensure that our activities meet goals in an efficient and effective way. Uh, and so this section focuses on the performance management initiatives of Alameda County that support the MHSA administration. So, if you're looking to learn more about this, you'll learn that this year we took the the MHAB, also known as the Mental Health Advisory Board's recommendations to shorten the plan, shorten this update. So what we were able to do was actually make this plan several hundred pages shorter, and that was a request from our Mental Health Advisory Board. We also provided hyperlinks, which even uh, helped the reader navigate as well. And so another thing that we improved on this year was our data management systems. We invested in additional data management systems called Yellowfin, and this allows our analysts to retrieve and analyze data faster, so we can provide feedback to the community and to providers. Uh, our Another thing that we did different this year, we had a reorganization in our ACBH. We reorganized our efforts. We implemented a two deputy director approach, which helped us create linkages to our core administrative functions, such as our MHSA, our quality improvement, our information systems, our financial services, and our data analytics. So those are just a couple of the performance management initiatives that I put on screen here, but you can read more. There's additional PMI initiatives in the report. Next slide. So now we're going to transition to our very last section of the MHSA plan. And so this is our appendices section. And so some tips that we have for you in terms of navigating this section, since it's so extensive, it's so robust, this is a really great place for you to look for documents and information that supplement the plan. We provide evidence of our outreach strategies. We provide evidence of how many stakeholder meetings we've held, the results of those meetings, as well as local evaluations that programs might have received, as well as our community input and what are the different demographics that was used to identify stakeholder affiliation. We also make sure that we are connected to our veteran population. For example, you can actually read information from all of our listening sessions and how every listening session was conducted. And every single piece of feedback that was provided by our participants is identified in this section. So you'll be able to see the subject and the content, but not the names of the people that provided uh, our community feedback. The appendices is also a great place to go and see the results from the 45-day public comment period. And so at the conclusion of this 45-day public comment period, which we are in the midst of right now, that ends on May 15th, we have the opportunity to respond to every single piece of comment of of public comment or feedback. Uh, then all of these public comments and responses are then published in the appendices section of the final plan. So once everything is approved, goes through the board of supervisors, then to the state, and then we have our final plan, which is usually available after the summer. So this is where you're going to go to read a response to a piece of feedback that the public provided. We put it in the appendices. And so you can provide comment from now until May 15th on the plan. Just visit our website, acmhsa.org. And so, yeah, so the appendices is a great place to find that level of content, as well as details about the community planning process. Next slide. So yeah, so that's the very last section of the plan. We've covered a lot of information. We've covered it very quickly, which honestly, all this information can be summarized into 3 points. Uh, that MHSA is funded through a 1% tax on personal income over $1 million. Funding is not guaranteed because sometimes it's volatile when we're relying on income taxes. The second point is that the MHSA plan is required by the state of California and must be developed every 3 years with the annual updates based off our funding cycle. And then the third point is that the plan has to include feedback that we get through the community program planning process, and that there's a 45-day public comment period. The draft plan right now is available for public review at acmhsa.org. And that's where you can provide feedback. You can also visit, if you're not familiar with it, our department's website at acbhcs.org. Additional resources are available at the MHSA website, specifically on our community input page. So we have documents that complement this webinar, and you can take a look at our outreach plans, other MHSA 101 PowerPoints. We have how to read the plan, infographics that summarize this webinar, and of course, this recorded webinar will be linked to our media partner, HHREC's YouTube page. So this concludes our MHSA 101 webinar on how to read the MHSA plan. And as a reminder, our draft in the MHSA plan for fiscal year 24 through 25 has been released, and it's open for the public to review and comment until May 15th of this year. During this time, you can hear more about the contents of the plan. You can provide feedback that's recorded. In the comments, of course, will be included in our very final document available later this year. Our 45-day public comment always culminates in a public hearing, which is hosted by the Alameda County Mental Health Advisory Board, or MHAB. The public hearing details are available on our website, acmhsa.org, and the public hearing will be available on May 20th at 3 p.m. and typically ends around 5 p.m. So we encourage you to attend because we'll have a more in-depth presentation on details that aren't covered in this general webinar. And then, of course, you can ask the public questions or comments that are recorded. As again, additional resources exist on our website at acmhsa.org and specifically on our community page. And so again, this concludes the webinar portion of our MHSA 101 series for how to read the plan. Thank you very much.